Good day, I'm Hanz Nicole from BSN-3D, and today I will be demonstrating how to use an incentive spirometer. The goal of this procedure is for the patient to accurately demonstrate this procedure of using the incentive spirometer. For the equipment, we need to check for the incentive spirometer. Review the chart for any health problems that may affect the patient's oxygenation status. This may include any heart, lung, or circulatory problems. Then, we are going to bring the equipment to the bedside table for ease of access during the procedure. Perform hand hygiene and put on your personal protective equipment if indicated. Then, identify the patient. Good morning, ma'am. I'm Hanz Nicole from the NUST, and I will be your student nurse for today. May I know your name, ma'am? I am Hannah Santos. And your date of birth? September 28, 2001. Great. So now I will just close the curtains around the bed and close the door to the room if possible. Then explain to the client what you're going to do and why you are going to do it. This is a device called the incentive spirometer, which is used to measure the air that goes in your lungs. So this means that I will need you to take a slow and deep breath into this mouthpiece. You will have to inhale through your mouth only, and you should not use your nose, and you should not exhale in this device. This will really help in loosening the phlegm in your airways and in expanding the tiny airways in your lungs, so that you can breathe easier over time. Then assist the patient to an upright position or a semi-Fowler's position if possible. This position will allow to maximize the ventilation in the client's lungs through gravity. Remove dentures if they fit poorly and assess the patient's level of pain and administer the prescribed pain medications if needed. So, Miss Hannah, are you using any dentures? No, I don't use any dentures. Okay. And are you in any pain right now? Just a little. So, in a scale of 1 to 10, with 10 being the most severe pain, what is your level of pain right now? In 1 to 10, my pain is 2. Demonstrate how to steady the device with one hand and hold the mouthpiece with the other hand. But if our patient is not able to use her hands, we must assist in holding the incentive spirometer. Then instruct her to take a breath to exhale normally and place her lips around the mouthpiece securely. Then instruct her to inhale as slowly and deeply as possible through the mouthpiece without using the nose. But if desired, we can use a nose clip to ensure that the client is not using her nose. Then, okay, I'm going to demonstrate to you how to use the incentive spirometer. We're going to hold this device with your right hand and hold this mouthpiece with your left hand. Then, I need you to inhale and exhale twice and use your normal breathing. So, you're going to inhale, exhale, inhale, exhale, and on your last exhale, you must place this mouthpiece in your mouth and place it securely, then inhale as slowly and deeply as possible. Okay, so I will hold this with my left hand and this piece with my right hand. For the flow-oriented spirometer, such as this one, if the white ball rises, this means that the client can inhale 600 cc of air per second. With the green ball, it means 900 cc of air per second. and with the blue ball, it means 1200 cc per second. For volume-oriented spirometer, when the patient cannot inhale anymore, the patient should hold her breath and count to 3. Check position of the gauge to determine progress and level attained. If patient begins to cough, splint an abdominal or chest incision. Instruct the patient to remove the lips from the mouthpiece and exhale normally. And if the patient becomes lightheaded during the procedure, tell her to stop and take a few normal breaths before resuming incentive spirometry again. Also, instruct or encourage the patient to do this procedure 5 to 10 times every 1 to 2 hours as tolerated. Alright ma'am, so now we are done with your procedure and now you can remove your lips from the mouthpiece. And you can inhale and exhale normally. And I'm going to need you to do this procedure 5 to 10 times every 1 to 2 hours because over time, your lungs will be exercised and the airways will be expanded so that you can breathe in easier. Okay, I will do so. Thank you. After the procedure, we are going to clean the mouthpiece with water and let it dry. And then remove your personal protective equipment if used. Perform hand hygiene. Then we are going to document the procedure done as well as your patient's response. And this ends my demonstration. Thank you for watching.